Okay, so today we start with an entirely new topic, and it is animal health. So after we've looked at the reproduction of animals, the behavior of animals, the management of animals, and so on, now we need to look at how to keep them healthy. So generally, before we head into different parts of animal health, generally there are 5 main things, or called 5 animal freedoms, that you guys must be aware of. The first freedom is known that all animals need to be free from hunger and thirst. I mean, this is kind of like the 5 basic rights of all animals. They have the right to not be hungry or thirsty. Secondly, they all have the right not to be have discomfort. That's what I was saying. They should not have discomfort. Thirdly, they should be free from pain, injury, and all diseases. So this third point is mainly where animal health comes in, where that if they do have a disease, us as humans must relieve them of this disease or their pain or fix their injuries. Fourthly, all animals must be able to express their normal animal behavior. Generally, this is a little bit difficult, especially if you have animals in intensive production systems like battery chickens. Generally, they can't move around, and since they can't really move around, they can't really show their normal behavior of picking and foraging and so on. So this is something that people generally have to think about, especially, and this is also where the controversy comes in between extensive and intensive production systems, because are battery chickens really that good, for the animal itself? This kind of is a sore point. Then, firstly, they should also be free from any fear and distress. So basically, we're going to focus on the third bullet point there, pain, injury, and diseases, and this is where animal health comes in. But generally, they can ask you guys name the 5 main animal freedoms, that then you must be able to list these 5 points. Okay, so first of all, generally they want you to know certain signs of healthy animals. Generally, they focus on the unhealthy animals, but it's good to know the contrast between the two. Okay, generally, just looking at this picture here, we've got a picture of a pig. It could be a picture of a chicken or a cow that they give you in the exam. But generally, just by looking at this pig, you can see it looks kind of healthy. I mean, we can look at the skin color of the pig. It looks nice and pink. The animal is generally clean. We don't see any blood. We don't see any wounds, sores, or anything. It seems like it can still move. There's nothing wrong with the udders. We can assume the sow has been suckling piglets, but there's nothing wrong there. Again, no bleeding, no sores or anything we see. Its snout is nice and clean. The mouth is not drooping or salivating. We don't see any drool anywhere. The eyes look nice and clean. The ears are kind of perky. The ears are swiveling around. We can assume swiveling around, listening to sounds and so on. So everything looks normal in this animal. So in this case, here are general signs of a healthy animal for any animal. Bright eyes, the ears are alert. The dung is of the right consistency and color. Usually, again, and urine as well. If you see dark red or brownish urine and feces, generally this means there's blood in the urine, and blood in the urine or feces is not a good sign. So that usually is a sign of disease in the animal. Thirdly, also the skin looks in a good condition. The animal is eating. It has the right body temperature. So temperature always a big sign. If the animal is too hot, again, it means it has a fever and it is definitely sick then. And lastly, it breathes normally and it is moving normally. So generally this is for any animal signs that it is in a healthy state. But looking at this slide, we can see that this animal definitely looks diseased. I'm amazed that this animal is still alive. So there are many things wrong with this picture. We can see the hooves are actually longer than it should be. The legs look a little bit bent and broken. We see sores everywhere. We even see mange. Mange is actually a skin condition where the hair is falling out. Even the eyes looks a little bit droopy. They say they're conjunctivitis, so there's something wrong with the conjunctiva on the outside of the eye. There's sores everywhere. Yeah, we can definitely see there's something wrong. Oh, and just by the way, the tail of this pig is gone. So it could be because another pig has bitten it off. It could have bitten it off itself. Or they say necrosis. Necrosis is when the skin and the muscle and everything dies and causes, in this case, the tail to fall off. So generally we can see there is something very, very wrong with this animal. So generally in the test, they will give you guys a picture of some animal and then ask you, do you think it's healthy, unhealthy? What is your reasons? So basically what you see. So here's some general signs of an unhealthy animal. Again, lack or loss of appetite, is losing weight. The hair is a little bit dull, or the coat of the animal is dull. The animal is tired all the time. I'm just nitpicking here. You guys can read in your own time. There's some nasal discharge on the eyes, nose. Sometimes the animal is salivating or drooling. That it grinds its teeth because of pain. Usually it has fever, so a high temperature. Labored breathing, definitely. Many times coughing. You can hear there's something wrong with the animal. And then the last point is colored urine. So again, you guys have to know if all these, but there's just some points where you take the easiest ones to remember, and if they mention it without giving you a picture and they just say mention 3 or 4 points of an animal signs that you know it's unhealthy, you can mention a couple of these. Okay, so I'm also going to go quickly through these general signs of poor health in cattle themselves. The main ones are the ones in bold. So the first one is ruminants. They generally are sick. They graze less, so they eat less, and this means that they ruminate less. And this is very bad for the farmer, not just, well, obviously for the farmer, but not just for the cattle, but the farmer as well. Because again, if they don't ruminate, this means that they will lose weight, because if rumination, if you guys remember, is when the animal turns fiber and cellulose and all those indigestible materials that they eat into amino acids, and the amino acids then are used to build muscle for the animal. And again, only ruminants, they get their proteins from non-protein substances, NPNs, and the fiber and so on. So again, if they don't ruminate, they won't have amino acids and they can't build muscle. So this is actually very bad. So this means generally, if the cow does not ruminate, it will have a loss in weight. Okay, so some other things I also say is sometimes the animal, if it walks with a lame gait means the animal has maybe a broken leg or a sore leg, so it hobbles or limps. There's something wrong with the way the animal is moving, so that's what they mean with gait. There's also a discharge from the mouth and the nose and so on. Something's wrong with the urine, the feces. The animal has a fever. And the second to last one, also in bold, says milk production of the dairy cows will drop. So definitely, if the cow is making less milk, there must be something wrong with the cow. If it maybe yesterday or the day before produced 20 liters and now all of a sudden only 10 liters, there's a sure sign that something is wrong with this animal. Okay, so some general points. Then they talk about general things for pigs. Again, this is actually much the same as the general signs, but also listlessness. The second point there, it means the animal's restless. It's moving around maybe. It looks agitated the whole time. And then also sometimes they shiver. They also are lame. They struggle to move. Maybe they've hurt their legs or something. And lastly, sometimes they can vomit as well. So these are actually quite general topics. I didn't make anything bold because not any of these are actually very specific to pigs, but these are some signs that pigs can show as well. Then signs of poor health in chickens. Again, you guys can read through most of these on your own, but the fourth point is important as well, because if the animal is sick, there's going to be a decrease in egg production, which is then bad for the farmer again, because less eggs, if this is his main source of income, he won't have any eggs to sell. Also, the one I did not make bold is the third to last point here. Oftentimes, if the chicken is very sick, its neck will become weak and sometimes twisted, so meaning the head of the chicken can lay on the ground. So even if the animal or the chicken is trying to move or stand up, well, oftentimes if it is sick, it won't want to move. It will just lie on the floor. But many times its neck is on the floor as well, and it looks twisted. Yeah, a chicken that is sick and is this weak looks it looks painful just to look at the chicken. So usually if the neck is also twisted and so on, it definitely means the chicken is sick. Okay, then method to test animal health. Okay, this is again very important and also in the textbook. So firstly, how to test an animal to see how if it's healthy. You usually take the animal's temperature, and usually it's done by a rectal thermometer. So you can imagine it's sometimes difficult depending on the animal. You can't really put the thermometer in the mouth of the animal, because sometimes they can either swallow it, they can also bite it and break it. So the best way of doing it is to put it into the behind of the animals. And this picture shows us here, again, to take the temperature of an animal, usually in the rectum. That is where you put the thermometer to get the most accurate reading. And it's the easiest. Then secondly, determine the animal's pulse rate, the number of heartbeats per minute. And the pulse rate is usually done at the backside here of an animal. Technically, your pulse rate and your heart rate is technically showing you the same thing. So you can either take the measurement here on the inside of the front leg, like the armpit area, or the same general area at the back here, the behind legs. So, yeah, pulse rate, heart rate, technically the same thing. Then thirdly, examine the animal externally for any abnormalities, meaning does this animal have any cuts or bruises, or does the animal have any ticks on its body? Usually ticks, they transmit diseases, so that is a sure sign. If this animal looks sick and it has a lot of ticks, it must probably, that's the source of it. So you just have to remove the ticks then to get the animal to be a bit more healthier. Fourthly, do a post-mortem. If the animal is dead, determine the cause of death. A post-mortem is basically like an autopsy. It's an investigation to see what caused the death of the animal. So usually the animal is then cut up so that you can see what happened on the inside and the intestines or the stomach and all those organs to see what happened. Then fourthly, test for diseases. And three ways how you can do this is firstly through blood smears. So this means that you take a blood sample from the animal and try to see what's in the blood, what caused the disease. Secondly, sample the excretions of the animal, so the feces. Look what's in the feces. Are there also any parasites or anything else that maybe can tell us what caused the disease? And thirdly, tissue samples, also known as skin biopsies. So literally they take a sample of the skin and see again, are there any foreign bodies inside the skin, what may have caused the disease in the animal. Okay, then how do you actually administer or give medication to the animal? And how you give something to the animal or the medication is based on the following. First bullet, you have to know whether this disease is systemic, so meaning does it affect the whole body of the animal, or is it localized? Does it only affect part of the body, meaning is it a broken arm, is it a broken leg, is the head hurt, is the wound somewhere, or is the entire body affected, meaning the nervous system and so on. So this is usually what a farmer has to keep in mind. And usually, technically, this has to do with vets, because vets usually prescribe medication and then they give the medication to the animal. But it's good for farmers to know this as well, because sometimes they have to self-medicate the animals. Second bullet point, in a really bad condition, that's important, meaning is the animal in a bad condition, because it might not be able to swallow anymore. So if it can't swallow medication, you can't give the medication through the mouth. Then you must inject the animal or do something else. Third thing to keep in mind is to see how serious the disease is, because, for example, if the disease is not so serious but it's a mild case, something like mastitis that affects the udder of a cow, only the infected part of the udder needs to be injected with medicine. You don't have to medicate the entire body of the animal or the entire udder for that case of the animal. Maybe only one teat is affected, then you just treat that one teat. And fourthly, the nature of the medicine is also important, meaning whether it's a powder that you must put into feed, or is it a liquid form that you can inject into an animal, or is it a cream that you can apply to the surface area or the skin area of an animal. So these are 4 points, 4 things to keep in mind before deciding what to medicate your animal with. Then methods of administering medication is also important, meaning firstly, the obvious one, can we mix the medication with the food and give it that way to the animal? Secondly, topical application, do we just put like a cream on the surface, the skin of the animal? Then a boiling gun and a drenching gun, these things are usually used to put the medication through the mouth of the animal. And the next slide, I'll show you guys some pictures of this. And also a stomach tube can be used. So a stomach tube literally is like a tube that's put through either through the nose or the mouth of the animal. It goes through the esophagus and then into the stomach. So this is usually when the animal can't swallow, then you bypass the swallowing muscles and then the medication is poured through the tube into the stomach directly of the animal. Then also rectal injections. So again, the vet gets an injection. Then also intramammary injections. This has to do with the mastitis or the udders. So intramammary means inside the mammary glands of an udder. So again, the mammary glands are the area that makes the milk inside the udder. Or then do you have to give the medication through the nose? And then also here, injections. So this is important. There are three main types of injections: subcutaneously, intramuscular, and intravenous. So subcutaneously, as you guys can see in the picture here, is just underneath the skin. The needle doesn't go very deep. This is where you release the medication. Intramuscularly is a little bit deeper. So this is your skin layer, then you've got a fat layer, and then a muscle layer. So it goes into the muscle itself. Then your intravenous. The intravenous goes into the bloodstream. So now this needle goes in deep, 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 so that it enters one of the blood vessels, and the medication is deposited into the blood vessel. Okay, then also, second to last point, you can either dip plunge the animal. So dipping is to get rid of ticks and fleas and things on the outside of the animal. And lastly, sometimes with chickens, you can put medication as droplets into the eye of the animals. So in this case, it could be the medication to put into the eye. Maybe the eye has an infection of some sort. So you can put it in with eye drops. Okay, here quickly is a few examples. So the balling gun, it looks like this. It's a long metal object. It's there to administer medication, usually in a tablet format, to animals that are unable to swallow. So again, you bypass the esophagus. This is literally put into the mouth of the animal, down the esophagus into the mouth. Then also the drenching syringe right over here. This is used to put the medication inside the mouth of the animal, usually for smaller animals. Then also we have an injection needle, this is an injection, and the needle will be in this part, or the injection apparatus. So you inject whatever medication it is, intramuscularly, intravenously, or subcutaneously, like we just said in the previous slide. Then a drenching gun is there to also administer medication, but usually with water, into the mouth of a large animal. Okay, then using medication sustainably, meaning as little as possible. You don't want to use a lot of medication on animals. For the first reason, it's expensive for the farmer to actually use. Then second, it may also weaken the natural immune response of the animal. So again, you want the animal to kind of have a fighting chance before you start to medicate it. If it's not a serious disease, let's say like the flu, then you want the animal to build its own resistance. Thirdly, it can have undesirable side effects if you over-medicate the animal. Fourthly, medicine will have decreased effectiveness over time on the pathogen, let's say a bacteria or virus, if you give it the whole time. You want to eliminate this pathogen, but if you keep on using it, it actually decreases the effectiveness, meaning it prevents the pathogen, or it causes pathogen resistance. So we want to prevent this. And the way to prevent pathogen resistance is by medicating as little as possible, but when we do medicate the animal, same thing for humans, we have to finish the course of medication. So if the vet prescribes some kind of medication, the farmer has to give it for 4 months. He has to give it for 4 months until the medication is done with. Otherwise, this microorganism will become resistant to the disease. If you start for 2 months, drop it, and then later give it again, because by then the pathogens would have multiplied and they would have gotten a resistance to the medication. Then it's ineffective. And also, it's very important that the correct medications are given. You don't want to give the wrong thing, otherwise the farmer will waste his money. Medicines can either be used for prevention or treatment, okay, and also expiry date of medication must be checked. That's actually very important. Then also the correct dosage is important, and the correct method of actually giving the medication, because again, if it's a powder format and for some reason you want to inject it into the animal, that won't work at all, because powder medication must go through the mouth. And then also lastly, vaccinate animals. This is a good way of preventing diseases. Okay, then just quickly, second to last slide, types of animal diseases. We get 3 types: infectious, non-infectious, and metabolic. So infectious is actually the obvious one. This can be transmitted from host to host or animal to animal through microorganisms. So a virus can transmit it, or a bacteria can transmit it from one animal to the next. And underneath this heading, it's very important to know that there are some diseases that are notifiable. So if they occur, it is required by law to notify the government of this. So this notifiable disease can be something like foot and mouth disease, or it could be something like, well, in human case, it will be something like COVID, because COVID, you have to say, okay, somebody had it, because it can be transmitted and it is basically a pandemic. So notifiable diseases are diseases that also can become a pandemic because it spreads so easily from animal to animal. Then thirdly, also there is zoonotic diseases. This is diseases that can be transmitted from animals to humans, and as humans can also transmit it to animals. So zoo actually refers to animals, so zoonotic means it can go from animal to human. So secondly, non-infectious diseases. It cannot be transmitted from one animal to the next, caused by factors such as overeating. So meaning this animal has now some kind of disease because it ate too much. It consumed maybe the wrong types of feed. It has an obstruction in its stomach, so it's some kind of physical blockage in its body. And then also intestines by ingesting foreign objects. So again, this disease, shame for the animal that has it, but the disease cannot be transmitted to another animal. And thirdly, metabolic diseases caused by disorders that basically disturb metabolic processes. This is usually when the animal has a vitamin or a mineral deficiency. So metabolic disease has something to do with metabolism. So it has something to do with something the animal ate. Also non-infectious. Okay, then lastly, level of seriousness of animal diseases. You get three types of seriousness: peracute, acute, and chronic. Firstly, peracute is very, very serious, usually deadly, meaning the animals can die from it. They can develop this disease within a couple of hours, maybe at the most 24 hours. Then if it's not treated, they could die from it in severe cases. So here an example would be anthrax. So we are going to look at this disease later on. And this, you guys have to know an example of a peracute disease, an acute one, and a chronic one. Then an acute, this develops within a day or two, sometimes a couple of weeks. So it takes longer for the animal to show symptoms and to develop the disease basically in its body. Sometimes it could be a mild case, meaning they survive. Sometimes it could be fatal, meaning they will die from the disease if they do not get treated for it. So then it can also disappear without it being treated in the case of influenza. So this is a mild case. It only shows after a couple of days or weeks, but they generally survive it. But in other cases, it can also cause severe outbreaks. In the case of foot and mouth disease, and it could be serious, meaning the animal will die from it after a while after the symptoms have shown. Then lastly, also get a chronic diseases. This develops over a long time, usually weeks, months, mainly years, sometimes because it takes so long to develop, but then the animal can live with this disease for the rest of his life. It's usually not fatal. Could be fatal, it depends on the disease, but many times the animal just lives with this disease through its whole life and never dies, unless it dies from old age. An example of this would be mastitis. So mastitis, again, the infection of the udder is not so bad. It just gives discomfort to the animal, and maybe the calves can't drink anymore from the udder, but the cow won't necessarily die from it. Okay, so that is it for this lesson.